Now, to a developing story that we're tracking, President Trump today made what he described as one of the biggest medical announcements in the history of our country. He says it's an answer to autism, linking the disorder to Tylenol use during pregnancy. But many doctors, including here in the Valley, remain skeptical of that announcement, believing it ignores decades of science. I spoke today with Desert Regional pediatrician Dr. Rebecca Ward. All right, Dr. Ward, tell us about today's announcement regarding autism.
Yes, so I'm a little surprised. Well, I guess not surprised because I knew this was coming, but this supposed link between autism and Tylenol use during pregnancy is something that has been floated around for years and has been looked at in observational studies. So I'm a little concerned where this supposed new data is coming from that is establishing this causation.
So is there research backing this?
So there have been many studies over the years. There was actually one of the most recent studies was a 2004 study out of Sweden where they followed just under 2.5 million children in Sweden born between 1995 and 2019, which actually tracked Tylenol or acetaminophen or paracetamol, as it's known in other countries, use in pregnancy, and followed them up through 2021 to see the rates of autism development. And while there was some association seen, once they accounted for certain confounding factors, like they did a sibling versus sibling comparison, there was zero link with the use of acetaminophen in pregnancy with not only autism, but neither ADHD or other learning disabilities.
So it sounds like you're skeptical.
I am very skeptical. We have been studying, what the potential cause or causes, because it very much is likely that it's multifactorial of autism for decades now. And so to suddenly say, oh, we figured it out in a few months, how is that possible?
So then let me ask you, is this something that you're going to take serious, or are you going to tell your patients just to ignore it?
I would like to see whatever data it is that they want, that they have to support this announcement. But in the meantime, barring any, life-changing evidence, as of right now, I would tell patients to not to get too upset about or not to worry. Tylenol has been shown over the decades to be extremely safe during pregnancy. It's one of the few medications that we do have available for pain during pregnancy that the American College of Obstetrics and Gynecology, ACOG, has supported as a safe option when used as directed, just like any medication during pregnancy. And there's been no association with any poor outcomes in the fetus and child as a result of Tylenol use.
Are you concerned this may give some people false hope about what the cause of autism is?
Absolutely. I do think that is an unintended consequence of this announcement, that people say, oh, if I just avoid Tylenol, my child won't have autism. And I think that is an unfortunate consequence that's probably going to occur as a result of this announcement.
Anything else, Dr. Ward, you would like to say about this topic before we let you go?
I mean, as always, if you have concerns about any medication, Tylenol or any other during pregnancy, is always good to discuss this with your doctor, with your OB-GYN, pending whatever information is revealed in the coming days, what data they have to show for this. I would say continue with your Tylenol use as normal.
Okay, Dr. Ward, we appreciate your time. Thanks so much for joining us.
Thank you for having me.